it's me, Lauren, from Speak from the Heart, where I give you all things speech, language, and life. I am a licensed and certified speech-language pathologist, and I'm so happy that you're watching this newest video. So let's jump right in. So I was thinking about, okay, I need to make a video, an educational video for everyone. And I remember a couple weeks ago, I was with a family member who asked me, what do you do? And I said, I'm a speech-language pathologist. And they said, a what? You're a what? What do you do? So I felt like this was the perfect video to make. And so in this video, I will be giving you all the education you really need about speech-language pathology and the role of a speech-language pathologist. I will try and keep this nice and brief, but I love my job, I love my field, and I think that speech-language pathology is one of those fields that is not as well known as maybe some others. So it is my job to educate you so you know that speech pathology is a resource. And if you're interested in becoming a speech-language pathologist, hopefully this video will give you some more information. Let's get to the real question. What is a speech-language pathologist? I will give you the very short, condensed response. But a speech-language pathologist is someone who diagnoses and treats a variety of speech and language disorders. And it's not just limited to speech and language disorders. That also includes cognitive communication disorders, voice disorders, and swallowing disorders, as well as social communication disorders. So we have a very wide scope. It's mind-blowing sometimes when I'm like, wow, we really know a lot. So another really common question that I get that kind of goes along with what is a speech pathologist is, what's the difference between a speech therapist and a speech pathologist? Pretty much everyone at my job refers to me as a speech therapist, but my title is a speech-language pathologist. And so the difference between speech therapist and speech pathologist, that term pathologist just means that we diagnose and treat. So we don't just treat individuals affected by disorders, we also diagnose that disorder, if that makes sense. So for example, a child may have a medical diagnosis of autism, but we diagnose them with a speech-related diagnosis such as an expressive language delay or an articulation disorder. The same thing goes for an adult client. So the adult client may have a diagnosis of stroke, a medical diagnosis of stroke, but they are being seen by us for aphasia, which is a speech-related diagnosis. So that really is the main difference, is that in addition to treating, we also diagnose, and that helps guide our treatment a little bit better. Piggybacking off of the treatment portion, a lot of people are like, well, what do you do? What do you do with patients? And so as speech pathologists, and this isn't just speech pathology, but we use evidence-based treatment. And that just means that we take a treatment that has been trialed and trialed and trialed with a certain population until it is proven effective to remediate whatever, is in error. So we're not just grabbing things out of the air like, I think this might work. Maybe if you turn your head to the side and stick your tongue out, you might be able to say this a little better. Like, no. We use evidence-based techniques. We read articles. We do research. Research is ever-changing within speech-language pathology, so that is really how we guide our interventions with our patients. We do have to go to school. I mean, a lot of careers, we have to go to school now. We are required to obtain a bachelor's and a master's degree. And once that master's degree is obtained, we have to be licensed in order to complete our clinical fellowship year. I'll get back to the CFY. You'll hear me say CFY. But with licensure, it depends on your state, so each state has a different requirement, but you have to be licensed before you start your clinical fellowship year. And the clinical fellowship year is a 9-month period where essentially we're working. I mean, it's really no different than just working a regular job. But the only difference is that we are supervised, so that speech-language pathologist is still under supervision of another speech pathologist for 9 months, and then that supervisor also provides ratings on like how you're treating, your documentation. But once that 9-month period is over, then you will obtain your C's. And you may hear a lot of speech pathologists say, oh, I got my C's back in 2017, or I just got my C's. But C's, it stands for Certificate of Clinical Competence. And so when we sign our notes or sign any document, we typically sign with our degree and then CCC-SLP. And that CCC just lets people know that we are certified to provide services as a speech language pathologist, and you no longer need any supervision. So it's like one of those days that most of us really look forward to, because it's like when you're a real speech pathologist. You know, who do we work with? That's another thing is, you know, another question that I often get is, well, who do you work with? What types of people do you work with? And really, it's a long response, but I will keep it short. But speech pathologists are able to work with clients from birth all the way up to adult geriatric ages. You know, our scope again is very wide, and we're able to really provide services to anyone who needs them. In the pediatric world, speech pathologists typically can work in school systems, they can work in hospitals, so NICU departments, inpatient rehabs. We can work in private practices and outpatient clinics. So it is a very wide range, and I'm pretty sure I'm probably not even including all of them, but those are the ones that I believe are the most popular. And then for the adult geriatric world, some of these overlap, but we're able to work in hospitals, so acute care, inpatient, outpatient rehab, home health. We can work in group homes, in nursing homes. Again, the scope is just very wide as far as where we can work and who we can work with. Pretty recently, actually, we also work with people who identify as transgender, and I wanted to specifically keep this one separate because that's not a disorder. You know, we don't diagnose them with a voice disorder, but we do also work with individuals who identify as transgender to help modify the voice, most of the time to make the voice appear and sound more feminine. So we usually use some voice techniques for that. So again, speech pathology is just very interesting, and I love what I do. So I hope this was helpful. Very simple, I know, very basic, but I can't watch 15-minute videos, so I just try not to do it to y'all because it's just not fair. But I hope this was helpful as far as giving you some more information about what I do, about speech language pathology, and the role of a speech language pathologist. If you have any questions about this video or any questions about speech pathology in general, please reach out to me. My email and my social media handles will always be down below. You can follow me on Instagram and on Facebook by the same name, Speak From the Heart. And I will see you in my next video. Make sure you share this with a friend and or family member. I'm going to challenge everyone to share this with 2 people because I just want you to. All right, you guys. I'll see you in the next one. Bye.